Hey guys, it's Friday, and I hope everyone has had a great week. This weekend should be a good thing. I am just now leaving the hospital, getting my IV bag of antibiotics changed out. So I will show you once I'm home what the pump looks like and all of that jazz. Headed now to go to Walmart to pick up a few things. We went last night because I'm doing collards again, and I use smoked ham hocks, and the Walmart we went to only had like one pack, and it only had like 2 in there, because the last time I think I had got a pack that had 4. So now I just have to go to a different Walmart and hoping they have it. I feel the antibiotic is working. Like when I first started, like the first couple days, because today's the 10th, so I started on Monday, and my incision was so sore, and I told my husband it feels like something is sucking, I guess, whatever infection that is there out from the inside, if that makes sense. And today, it's not sore. I haven't had any major side effects or anything from the antibiotic. I think the first 2 days, because the side effects, the normal ones, are just having like diarrhea. And I really wouldn't even call it I had diarrhea or anything. I know this is TMI, but I'm just being real. It was just like normal, but I had like some cramping in my stomach the first couple days. And at night now I get like an itchy sensation, but I just take a little Benadryl and I'm fine. I don't have any issues, after I take the Benadryl. So, yeah. Only thing I don't like is I have to go every single day to get a new bag of the antibiotics. That part I can do without. So that's the only drawback of, doing this, because I have to get up every day. Normally I have to be there by 9:30. Today was a little later. It was 10:30, so that was nice to get to sleep in. But the only thing, like, of course, I'm having my normal lupus stuff because of me not sorry, the sun. This weather, Lord, it don't know what it wants to do. What was I saying? Oh, okay. I have my normal pains for my lupus, and I'm really, really extra tired. So normally after I get to the hospital and get home, I just go to sleep. And I've been doing a lot of sleeping. I went to the thrift store yesterday after, I went and got the bag changed. But for whatever reason, like, I know with lupus you have unexplained fevers, and that was a symptom that I never had an issue with. But I've had a fever now probably within the last month 3 times. It's a low-grade fever, but it's a fever. So I think that's part of me just not feeling good, and my body just has to rest. And I'm not even mad at this point. I just want to get better and let this antibiotic do what it has to do, and I can get back on my regimen of medications. So that's just my prayer. I go back to infectious disease next week, I believe, because he wants to see me before my 2 weeks is up, to make sure things are going good and to make sure I don't need it any longer. From what I can tell, like, there's no more drainage, at the site. But my only fear is I want to make sure I have enough antibiotics in my system, because it seems like I do good when I'm on the antibiotics. Is when I come off and it starts back again. So I don't want to go through that. But other than that, everything's been, pretty good. Yesterday, like I said, when I had the fever, as soon as I got home, I just rested. And once I rested, like I said, I was still tired. I've been having like headaches more for whatever reason. I don't know what's up with that. And I know it could be just because of the lupus, but last night we had a board meeting for the track club, and we had a coaches meeting. So we met at a restaurant. So we were there from about 5 o'clock to probably 7:38. So that was kind of long. But we got things accomplished that needed to be accomplished. And let's see, what else has been going on this week? I saw the pain doctor Wednesday. I didn't record. She was saying, because I told her I was like, my back this past weekend, I was literally stuck in bed, could barely get up really to do anything. So she was saying, well, I couldn't get an injection in my back because I'm on those antibiotics. And she said that she could order a new MRI and do a new nerve conduction. And I'm not going through any more nerve conduction studies. Not going to do it. That is the most painful procedure that you could have. If you're just doing the EMG part of it without the needles, that's fine. But when they start sticking those needles in your legs, that is painful. Like every time I get them, I'm bruised like for like a whole week or two. So I really don't want to have to go through that. I told her I would wait and see how I feel, once I'm off of the antibiotics and back on my lupus meds, if that makes a difference. But then at checkout, well, let me rewind. She wanted to ask me if I wanted to increase my pain medication, and I told her no, because she wrote a new script for pain meds with a whole lot more quantity, because she wanted me to take it more frequently, because I was in so much pain. But I told her that my liver enzymes were elevated at the beginning of October's labs, but they were back to normal on my labs on the 25th. So I told her I didn't take it like she told me, which was every 4 to 6 hours, because I didn't know what was going on with my liver, because that's never happened. But the rheumatologist, for whatever, she said, oh, well, that's not uncommon for people with lupus to have elevated liver enzymes. But that's not an answer to me. Why is it being elevated if I don't drink anything like alcohol related, and I'm not really taking a whole bunch of pain medication? So why would it be? So are you telling me my lupus medication for my infusion, is that the cause? Is the CellSup the cause? I need to know that. You know what I'm saying? So I don't know. I'm just at a wit's end with all doctors at this point. But my pain doctor is super, super sweet. But as I was checking out, they give me this letter, and I'm like, okay, what is this letter about? And she's pregnant, and I never knew she was pregnant, because you look at her, you would never know. I mean, she has her lab jacket on, but I guess she was hiding it, and she's literally going to be on maternity leave starting January to April. And I'm like, what the heck? And so she's saying that she was going on maternity leave, that her colleagues would be handling us, and she just wanted to share the news and to I guess reassure her patients that we would be taken care of while she was off. I was like, oh Jesus, that's a long maternity leave, but it is what it is. So I go back to see her in December, so that'll be before she leaves, so I can kind of discuss a game plan, because I already know, like, when you see other doctors that's not your doctor, like, if you needed a change in your medicine, they're not going to do it. So it's like, what do you do at that point? So I think what I'll do is make sure she can give me a script for the breakthrough pain, which I still have some, but the fact that she's going to be gone for 4 months, I'd rather have them or have the script on hand than to have to deal with her partners, to deal with all of that jazz. So that's pretty much. I'm trying to think, have I left anything out? I feel odd because I had footage from pretty much every day this week, but I guess I didn't really feel the best, and I was just tired and drained, so I just felt like I was rambling and it wasn't anything productive in the video, so I deleted them. And I was like, well, I'll just start, fresh. Okay, you idiot. You're stupid. How do you just go across 3 lanes of traffic and then just stop? People are just, The other day it was raining and people, like, they had lost their ever-loving mind when it rains. Like, nobody could drive. It was just horrible. Like, these people are just crazy. So, yep, that's about it. So tomorrow I'll go at 9:30. Sunday I go at 9:30, but I asked them if they could maybe squeeze me in earlier on Sunday, because our church that I go to, that it starts at 9:30, and I haven't been there since my surgery. So the church secretary sent me an email. Well, my husband's best friend that married us is the associate pastor of the church, and so he was like, I need for you to be at the ornament exchange. And I just laughed about it. And then I have an email at almost 9 o'clock where the church secretary is inviting me to the ornament exchange, and I'm like, I really didn't want to go. I get the emails, I know it was going on, but I didn't want to necessarily attend, because he was like, oh, well, you're looking good, because we didn't tell him I had surgery. It wasn't until I sent a message to the secretary about my surgery that he knew, because I don't feel like I have to tell everyone that, like this around us, because we felt like, okay, this was going to be outpatient, ain't nothing, I knew what to expect, not knowing that I was going to have to go through all of this. So, yeah. So, I'm like, when he says that, and I'm thinking to myself, yeah, I may look good, but I don't feel good. So, it's next week. So, now I have to go find an ornament, and it has to be an ornament that's related to Heaven and Nature Sings. So I guess I'll look and see what Walmart has, and I'll go to Hobby Lobby. So while I'm in here, I've got to get wine. My friend is having a wine and cheese party, and I told my husband it's not like I can't drink. When I do have a drink, it'll be a sip of wine once or twice a year. So I can't have anything, especially being on these strong antibiotics. That was one of the major things that they said. But I'll go. It's from, I think, 6 to 9 or 7 to 9 or something like that. It's just, I don't want to cancel, because I always seem to have to cancel on everything. So I'll get a bottle of wine to take and just go partake in activities and put a smile on my face. And, today I feel, okay. I have my joint pain, which that doesn't go away. But for the most part, I feel okay. I had some chest discomfort, and I think it's I don't feel it's cardiac. I feel like it's something with inside, because breathing kind of hurts sometimes, and it's my boobs, TMI. I guess they're just the heaviness, when you're laying on your side without a bra on. So now I'm having to put a towel in between, so it's not I can breathe, if that makes any sense. My oxygen level is still up and down. But one thing I know, my heart rate has been literally no less than 90, but as high as 120. And I don't know if that's just because of everything that I'm dealing with, or this antibiotics causing it, or me not being on my meds. I really don't know. So I'm trying to keep an eye out on it. And last night when I had the bad headache, when we got back from our meetings, trying to think what I'm gonna do. I have to go to the post office too, so I'm gonna just. Oh, they're not even open because it's Veterans Day. Doggone it. But I'll go anyway to get my mail out of the P.O. box. I didn't even think of that. And I guess I should say Happy Veterans Day for everyone that has served the country and is serving the country. Thank you for your service. My husband's a veteran. My dad was a veteran. He was in World War II. Yes, my dad was old. So, yeah. Back to what I was saying. Like, so the chest thing and, you know, the heart rate, I'm just trying to watch it. But my oxygen was like 80 last night when I got done for the meetings. And my husband's like, well, what do you want to do? And I was like, I just need to sit down. I'll be okay. And it came right back up once I had a seat and, you know, caught my breath and all that jazz. So, yeah. So I'm at Walmart. And it's like everybody and their mama is out here because I guess kids don't have school today. Alright guys, as promised, here is the IV antibiotic that I'm doing. It comes in a little fanny pack, which is so not my style, so I'm blinging it out. I'm not finished. But inside, I can take all my wallet and stuff out. It has this little guy. They program it every time I go. It's locked, so I can't really do anything besides press stop and off and on. And the antibiotics, there you go, come in a bag like this. And I go and get a new bag every day or every morning. And it is scheduled for every 12 hours. This is the line, and I'm going to stop it and show you. So it is connected, try not to flash, to my Metaport, and they have it all covered because they keep it accessed the entire time. On Monday, I will go for a dressing. I'll have my dressing change, and then they have to do lab work. So with this specific antibiotic, you have to have peak and trough levels to make sure your body isn't getting too much, or, you know, because it can damage your kidneys and different stuff like that. So Monday when I go in anyway, they're gonna take the de-access the Metaport, and then they'll re-access it, because then I can go for 7 more days, if that makes sense. But the antibiotics are every 12 hours. Like I said, originally I was doing them at like 10:30, and they're 90 minutes long. And the machine will just automatically cut on, automatically cut off. And I'll insert the clip that I put on my Instagram. The noise is aggravating. I just want you to hear what I have to listen to for 90 minutes. Take the wheel, Jesus. So the other day when I had my pain management doctor's appointment, I got to infusion late. So my time changed. So now it's like, I know it's not 11:30 because it's 11:30 at night now. So I think it's like 11:45 that it starts. And then I have to go the 90 minutes. So when you're really tired and you want to go to sleep, that doesn't happen. But so far so good. No side effects other than a little itchiness. But I feel like it's working. I pray that it's working because I normally feel better like being on antibiotics, but then things happen when you get off. So I'm praying that this is strong enough that when I am done, I'll be done. So I just want to come on and let you guys know that I did not get to do the Faith Friday. You can see my butterfly rash. So my friend had a wine and cheese party, and it was at her mom's place. And I was like determined I was gonna go, because I always have to, cancel and can't do stuff. So when I got done at infusion in the store today, I came home and laid down, try to rest up. So I didn't take a jacket because it was cool, but it wasn't cold. So when I got there, why was it in the backyard with a pit fire? It was really pretty. I'll insert a picture of the fire, but it was cold. It started to really get cold. Like at first it was okay, but then we were watching Girl Trip, which is hilarious. I didn't stay the whole entire time because I had to get back home to get my meds, my other meds in me before this med starts, because I try to space it out so nothing can interact with anything. So I left at like 10 o'clock and I got there about 6:15 or so, I think. It was before 6:30. So it was fun to get out, but my body wasn't ready for the nippiness of the weather, because I didn't know it was going to be outside. But like I said, we had fun just sitting around. I couldn't have any wine because of the antibiotics. So I had my nice little bottle of water, but it was good just to be able to hang out and get out of the house, because I've just kind of been gloomy, down and out, just because of everything having to deal with. And it seems like you take 2 steps forward and 10 steps back. But I know it'll get better. We'll probably do the marriage series tomorrow. And I may publish it or just put it out for next Friday. But I do apologize because I really want to try to be consistent on that. But literally, like every day that I come home, I'm just out and keep having those, the fevers, the low grade fevers. And that takes a lot out of me also. So I've just been listening to my body and trying to rest and do what I have to do to get better. So if you have any questions about anything that you have seen when it relates to this IV treatment, I think it's a very awesome way to get your infusions. Of antibiotics if you have to be on them. But driving to the hospital every day is not my cup of tea. I think I finish next Monday. No, not the Monday coming up, but the Monday after. I think it's like the 20th or 21st. And so it's just frustrating because like in the morning I have to be there at 9:30. And it's Saturday and you want to sleep in, but I can't sleep in. So yeah. Same thing for Sunday. It's at 9:30 and church starts at 9:30. So they said that they'll probably get to move me earlier when they open at 8. Because they're only there from 8 to 12. So I hope there's not a whole lot of people that have to come on the weekend. It's normally just the people that are on antibiotics. So, alright guys, I will be blessed. And I hope you have a good rest of your Friday. It's almost midnight. It's not midnight yet. It's almost midnight. So your girl is going to try to lay it down and get some more rest. Because as you can see, the face is starting to, the butterfly rash is coming. But I'll talk to you guys later. Be blessed.